We're told that 1 out of 6 of the world's population are adolescents aged between 10 and 19 years, and therefore, recognizing adolescents as key partners in advancing our SDG targets is critical. Yet for some time now, the health and development interests of young people has not captured meaningful attention at leadership and policy level. Interestingly, global and national health strategies continue to group adolescents and youth together with women and children, making many assumptions about their health needs. Not surprisingly, this has resulted in numerous urgent calls to address adolescent health care, because while adolescents have been perceived as healthy, they face considerable risks of adverse chronic health issues. Data has registered higher rates of violence and injuries, addiction, depression, and mental health issues in this age group, an indication that we need to step up our efforts if we, as leaders and guardians of the youth, want to leave a lasting legacy for future generations. One of the major concerns of our time, especially in the African continent, is the new surge of illness facing young people as a result of the non-communicable diseases and HIV. This new challenge calls for our urgent attention. We must not accept to reverse the gains we have made in health. We must encourage young people to access health services. I'm convinced that we can respond better to the needs of the youth by rethinking how we can get them to prioritize on their health and uptake of health services. We should consider, for instance, using technology and social networks, peer-to-peer connections, and social engagement to advance their health service options. In my experience, interacting with adolescents through the Pupils Reward Scheme, PURES, a mentorship program that was started by His Excellency President Kenyatta, I have learned the importance of listening. Adolescents and young people form a key part of my work in Beyond Zero, so that we can build better synergies and integrate their voices in our advocacy and education dialogue. I believe that while adolescent health is important, we must go beyond just focusing on disease or ill health. We must promote investments that enhance self-esteem, determination, and resilience, especially among young women. In Kenya, we have tried to be deliberate in our prioritizing activities that celebrate our youth. We have celebrated the contribution of the youth to new ideas in technology. We have seen their groundbreaking discoveries using the internet, mobile telephony, and other technologies for sustainable development. These are talents we must tap to remove barriers that hinder adolescent access to health services. We're steadily making progress in involving young Kenyans in leadership programs that encourage meaningful engagement. We're promoting youth-led initiatives like Maisha Youth for the promotion of health for the youth. My Beyond Zero initiative has committed to promote peer-to-peer learning programs to develop a cohort of role models and trailblazers. As I conclude, I encourage us, older generation, to think back to a time when we were young, when we felt invincible. This is the same way our adolescents feel today. So let us listen more, be more inclusive, make information available, invest more time and resources towards innovating health delivery services that speak to our youth.